Hello, I am Prasad Vannem Reddy. I am neurosurgeon for 30 years now. I was first of all a general surgeon to start with. I welcome you guys on behalf of Eagle Health just to introduce you to the structure of spine, which is a very important one protecting us, and then how it plays a vital role in our lives, because the quality of life depends upon the health of spine. So as somebody some long time back said, you are what your spine is, because people with a healthy spine look a little younger and then healthier also. People who are not having healthy spine look older and then they look sick. The spine basically is something that protects spinal cord. Spinal cord is a structure that is coming from brain, and that's a connection between the rest of the body and the head. From spinal cord you see spinal nerves come which go to the rest of the body. Like from the neck part they go to the upper limbs, that means the arms and hands. From middle part of the body they go to the trunk, that is chest, then abdominal cavity. And the lower part of the spine supplies the nerves to lower limbs, that is legs, thighs, legs, and then feet. And also this thoracic and then lumbar, that's the middle part of the spine. It supplies the crucial parts that are sphincters. Sphincters are the ones that control both urination and then defecation. And that means the sacral functions are controlled by that part of the spine. Cervical spine is the initial part of the spinal column, which is a bony structure divided into segments. First 7 segments are called cervical spine segments. And then the 12 segments in the middle are called thoracic spine. Thoracic spine is the chest. Chest means here you see the rib cage, and then rib cage goes around the chest. And then below that is the abdominal cavity. Abdominal cavity is partly supported by the thoracic spine and then 5 lumbar spine. 5 lumbar vertebral bodies are the back. What colloquially we call as a backbone is lumbar spine. And of course sacral bone is the lowest part of the spinous processes, and then that's where we sit. We are sitting on this part of the bony structure, which is called pelvis, and then sacral bone passes in the middle part of that. And coccyx is usually a small spicule, which is the tailbone. Tailbone is in human beings is reduced to either 2 or 3 pieces of bone, which usually serve no purpose. But the only problem with this is they can be cause for severe pain, what is called coccydynia. But the thing is we cannot get rid of them. Anyway, coming to the top part of the spine, it is called cervical spine. Cervical spine is a very important part of the spinous process, spinous system, because this is a junction between the head. Head is sitting on this. This is the bone that's part of the skull. And then this sits on the cervical spine. The first cervical spine body, that's called atlas. Atlas takes the entire brunt of the skull on this. From atlas, then the next body is the called axis. It is very important because axis controls the rotational movements of the head from this side to that side. And then we have got 5 cervical spine bodies which contribute to the neck movements. Like you're bending your neck, and then tilt to the side and tilt to the other side and move it. These things carry the most important thing, like hand function, and more important than hand function is the respirations. All the respiratory muscles are supplied by the cervical spine cord. So cervical spinal cord like 3, 4 and 5, these are the ones that go to the diaphragm. Diaphragm is the muscle sheet that divides the thorax from abdomen and then supports the respiratory system. So they are supported by this phrenic nerve supplied by C3, C4, C5 and sometimes C6. This is important thing because when the neck is broken or whenever there is an accident producing damage to the cervical spine, C3, C4, C5 might be damaged. So whatever you do, unless the respiratory system survives, the human body cannot survive. Because the entire body is dependent upon the oxygen supply coming from the purification of the blood by the lungs. So once lungs are not functioning, lungs are functioning because diaphragm is moving, pumping out the carbon dioxide out, and then Lungs are moving because of diaphragms taking the oxygen. Oxygen has to go to the rest of the body. Once C3, C4, C5 are not functioning well, that function of the diaphragm suffers. That's the crucial part in our practice, especially when there is a tumor inside the spinal cord, or when there is a broken kind of bone, and somebody is hit by a moving vehicle, or when there is a disease, like sometimes even vertebral bodies get disease. The common thing among those diseases in India is tuberculosis. If the tuberculosis is involving these bones, like C3, C4, and C5, these nerves also get damaged, and then ultimately the diaphragm also may get paralyzed. That is the most important part of that. And then coming to C5, C6, C7, those vertebral bodies, they are protecting the spinal cord that supplies the hands. All said and done, shoulders, okay. Upper limbs, forearm things, strength, if they are there, that's good. But hand function is the most important thing for mammals. You have to realize that thing in the evolution, that monkeys are unique in the sense monkeys have got prehensile strength, because even their thumb is very much well developed. That's where we get our function of hand from. Imagine if hands are not there, what good the upper limb is? It's absolutely of no use. I cannot say no use, but hand function is the most important thing, because if you want to feed yourself, take care of yourself, these 5 things are going to be very useful. So that is a key part of our management when there is a spine broken or damaged or diseased by different things which I have explained. That we always focus on hand function. So our ultimate goal is to save these roots supplying to C6, C7, C8, supplying the hand. And coming to the thoracic thing, which is very long bone and 12 segments in length, which is usually not damaged by trauma or pressures and things, because there is a rib cage around that. Rib cage not only protects the lungs and the heart inside that, it also is indirectly giving a lot of support to the thoracic bone. Thoracic bones, even if they are damaged, owing to the strength given by the rib cage, they usually do not require a lot of surgical interventions, unless there is this kind of dreadful disease called tuberculosis, which is again very common in these bones. Otherwise, most of the time, thoracic spine vertebrae, even if they are broken or damaged, surgical treatment is much less often required compared to the cervical spine. And coming to the lumbar spine is very important, because the entire brunt of the spine is taken by the lumbar spinous components, and these things control the functions of urination and then defecation. The sphincter control comes from the lumbar spine, L1, L2, where the key parts of spinal cord are located, which is called conus medullaris. Conus medullaris controls this function of the sphincter. Sphincter function means, for example, you are in a meeting or in a movie, you want to go to urine. Even then, your urine is full, you can still control that. But an important scene is going on or something is happening on the movie screen, you don't want to go. That's where these sphincter controls comes in, and then you can sit through the movie, and then after the movie is finished, you can go to the bathroom. Those things are controlled by conus medullaris, and then the sphincters inside that. Sphincters controlled by the nerve supply from there. And then lumbar spine is also very strong and sturdy, and then not usually damaged by the usual run-of-the-mill kind of trauma. It requires very huge strength to break these lumbar spine bones. But unfortunately, most of active people in the young age suffer from what we call as lumbago or sciatica or disc disease or back pain. Back pain is, almost seen in 100% of the people in their lifetime. I'm not saying that 100% of people all the time and things like that. In their lifetime, everybody suffers from back pain. It is because the back suffers, takes the brunt of all this weight coming from there. And this is highly mobile, because if you are flexing your body front, back and sideways, lumbar spine takes all those things. And then when you are playing or when you are running or when you are jumping and all those things, the disc material gets torn. When disc material gets torn, these are the nerve roots coming out of that disc space. They come and fall on these nerve roots. Once there is a pressure on the nerve roots, they cry. Once nerve roots cry, we all cry, because they are carrying the pain sensations. So that's when the sciatica, the back pain, this lumbago, and then all these things come in. Then sometimes this disc material needs to come out. That's when we take part of this bone and then remove the disc and relieve the nerve from the pressure. Rest of the diseases like tuberculosis and tumors are not very often seen in this region, except for because this area is full of nerve roots. Some of the nerve roots may be bearing small tumors called neurofibroma. That's the only kind of common tumor in this region. Coming to the sacrum, sacrum is kind of the bone that's very well damaged, most often in females, because females are childbearing, and there is always a lot of pressure on the sacral region while they are giving birth to a child, and because this is the area which undergoes a lot of stress and strain during the childbirth kind of period. And this pain also mimics the sciatica, and most of the times there is no surgical treatment required for this, except for temporary pain relief medication, and then some kind of bed rest. Coccyx, like I said, it's really what they call is pain in A, because there is hardly anything it does, and unfortunately there is hardly any effective kind of treatment that can be given. But since coccyx has attachment to a lot of these muscles, we don't remove that cut and take it off, and then those things do not happen with coccyx. So in short, this is the role of the entire spinal column, which is very protective in nature, taking care of the spinal cord that is traveling inside. I hope this is going to be useful in your daily life. Thank you for watching Eagle Education. If you have any questions, doubts about this presentation, please make a comment. Thank you.